Hey everyone, and welcome to Holding the Line with GY6 Counseling. I'm Peggy, and this is Brittany. This is a space where we get real about the shit nobody wants to talk about: mental health, life, trauma, healing, and everything in between. Sometimes we get clinical, sometimes we get messy, but it's always honest. Quick reminder, this podcast isn't therapy, and it's not a substitute for professional care. We're not here to provide therapy, diagnose, or treat. If you're struggling with mental health, please reach out to a licensed provider. You don't have to go through it alone. We've got your six. We're just two trauma therapists showing up as humans first, ready to have real, unfiltered conversations about the stuff that matters. We're here to break the stigma, share what we've learned from both sides of the therapy room, and talk about the challenges people face every day, especially in the veteran and first responder communities. Whether it's trauma, burnout, relationships, identity, or just getting through the week, we believe that these conversations matter. They deserve space, and that's what we're holding the line for. So let's dive in.
Hello and welcome back to another episode of Holding the Line with GY6. Today is season 2, episode 9, When the Pain Doesn't Clock Out. Today we're talking about chronic pain, autoimmune disease, trauma, and mental health.
You know chronic pain very well.
We're all chronic pain, autoimmune girlies here.
I think the entire office pretty much is.
Yeah, between me, you, Christina, I'm not sure about anybody else, but I know that we all struggle with it too.
And when we talk about chronic pain, it's the pain that doesn't end when the shift is over. Whether it's an old injury from duty, years of wear and tear, autoimmune disease, or pain that just doesn't have a clear explanation. You're just like, why do I hurt all the time?
Right.
Chronic pain has a way of just following you.
I was joking the other day because one of my veterans was like, yeah, I got to go get my, what did he say, knees or my feet taken care of. And I was like, if you're a veteran, you can pretty much guarantee that your back, your knees, and your feet are shot. You might even need replacements. It's a given.
And for military members and veterans and first responders and healthcare professionals, this pain is normalized. We just expect sore backs and bad knees and aching shoulders and just sleepless nights. We tell ourselves it's part of the job, right?
Yeah, literally.
But chronic pain is more than an inconvenience. It affects the brain, your relationships, your identity, sleep, mood, overall quality of life.
Sleep's a big one. Sleep's a big one for me because sometimes why aren't you asleep? I'm like, because I'm hurting. I'm hurting too bad to fall asleep right now.
Today we're going to unpack more of that, what chronic pain really is, how trauma and stress influence pain, because a lot of people don't realize there is a connection between the two, why autoimmune diseases often affect mental health, and why treating the whole person, not just the injury, is very important.
Yeah, so everybody hurts, right? Ugh, I hate that. Also, normalizing the fact that people like, I say us, me and you, have chronic pain. Our pain tolerance is so much higher. So you go to the hospital and you're like, I think I might be dying. And your blood pressure is normal, your pulse is normal. And you're like, yeah, it's an 8 out or 9 out of a 10. And they're like, but you look fine because I live like this every day.
Yeah,
You hear the same thing over and over again.
People with chronic pain, their pain scale is altered from what I consider like a normal person's.
Yeah.
Because people with chronic pain, like, you're living in the constant 3, 4, 5. So like that on a normal person's scale is their 8, 9, 10. And that's just every day for us.
Absolutely. It becomes part of our culture. It's a badge of honor. And my mom, I'm going to call her out on this. It doesn't matter how bad she's hurting. She's going to go and do the thing that she needs to do or that she's obligated herself to do. And I think that is such a toxic culture that generationally we lived in, right? Where it's like, oh, we pushed through. It's a badge of honor that I came to work feeling like crap. And that's how we ended up in a global pandemic. But that's another episode altogether.
Military members that, like my husband, refused to go to sick call. And I'm like, you're allowed to be sick. You're allowed to hurt. And he's, no, I'm just going to go to work today.
You're not a robot, right? It hurts. You need to go rest. Otherwise, you're going to keep getting more and more sick. We need to touch on that later. What happens when you don't rest?
you spend enough time around military members and first responders, you're going to hear the comments over and over again. My back has been messed up for years.
My knees are like Rice Krispies.
I just have to get through this shift. I can rest tomorrow. I'll deal with it when I retire.
I always say I'll sleep when I'm dead. There's no time for it now.
God, if I get enough like veterans around each other and like they're comparing their injuries to each other.
Yeah.
Like, I got back problems. You got back problems? You got any problems? What's your injury? This is my injury. I'm like, would y'all stop that? Oh my God.
Y'all are toxic as hell.
It is the most hilarious thing because I love it when my husband gets around others and I'm like, y'all aren't supposed to be comparing.
Like, y'all know this isn't normal, right? It's not
Love it.
normal.
I love it in the best and worst way because I'm like, look, it's a play date of injuries.
The truth is that people suffer from chronic pain way more than you realize, and it's way more common than you would think.
According to the CDC, nearly 21% of adults in the United States, more than 50 million people, live with chronic pain. And about 8% experience high impact chronic pain, meaning it significantly limits their daily activities, work, or quality of life.
Among veterans, those numbers are even higher. The U.S. Department of Veteran Affairs estimates that like 50% of males, 75% of females receiving VA care report chronic pain.
Those numbers just boggle my mind. But
Well,
it's
if you look
also,
at it from a trauma
yeah.
perspective, it makes sense. We're getting there.
But also think of what their body has been through.
Yeah,
The marches, the armor, the
the
repetitive
boots.
lifting, yeah, the lifting, the physical training, the deployments, the injuries, the just repetitive stress on the body.
Yes,
And
and first responders too, right? Especially if you're a
mm-hmm.
firefighter, all that gear you have to carry and wear. You're bending over, you're putting people in awkward positions, not people, but yourself, right? My sister herself injured her back, leg, something, twisted her ankle and fell out of the ambulance, putting somebody inside of it. So there's really no way that you couldn't hurt yourself in that situation.
Police officers, they're carrying around the equipment, the belts,
Ugh.
the vests, the armor, all of it. And good
If you've
help.
never felt the weight of that just belt that goes around their waist, it is incredibly heavy. It's unhinged how heavy it is. Like, how do you walk around like this with your Batman belt all day?
Healthcare workers and they get constantly left out of this one because like
Yep.
nurses and doctors
Nurses.
and everything and nurses especially, oh my, but it's like repetitive injuries because they're lifting in stupid positions too. They're having to reach around to patients in awkward positions and it's physically demanding.
Yeah, and there are usually not as many people working as there should be, so the ratio's off. So you've got nurses doing way more than they should, more often than they should. How many nurses do you know that has back problems or shoulder problems? All of them. All of them.
My dad has been taken down I don't know how many times because he works with juveniles and he has literally been taken down.
Same. I've been there.
As a nurse, I'm like, I'm sorry, Dad. That seems no, thank you.
So now that we know a little bit about it, I think it's important that we actually define what is chronic pain.
The International Association for the Study of Pain defines chronic pain as pain that lasts longer than 3 months or continues beyond the normal healing process. And one of the biggest misconceptions is that chronic pain always means something is still damaged.
Sometimes that's true, right? Pain is your body's way of letting you know that something's not quite right. But for chronic pain girlies like ourselves, there is nothing wrong. We've had all that ruled out miserably by doctors.
So many doctors, and it's hearing, everything looks fine. I'm like,
Are you
you
sure it's
lying.
not your period?
It's anxiety.
Yeah.
Please shut up. First of all.
Yes. I encourage people to say, what was your difference if you're a woman? And men just don't get it. I'm sorry, you just don't because you're not us. But men can go and get all sorts of meds and the doctor's appointments and referrals they need. We have to fight tooth and nail for it every time.
Sometimes like the injuries heal months or years ago and because there was something wrong, but the
Yeah.
nervous system like just continues sending pain signals.
Like a smoke detector.
Yep. And it's designed to alert you when there's danger, but what happens when that alarm just continues to become sensitive and goes off every time it smells something burnt? I hate it because it's been years and it still goes off, and it's
Yeah.
like, okay, we're gonna hurt today. No, thank you, I'm done.
I think for some people they overdo it, which then pushes them into a flare or chronic pain issue of some sort. But if you have old injuries, then that also makes sense. You can get surgery to heal it, but it's still never going to be quite like it was before.
And if you overdo it, that injury tends to let you know you have overdone it.
Yes, yes. But a lot of people don't listen to those signals. But it's totally real for your brain and your body, even though they're not quite talking to each other like they should.
We've been a lot of us have been conditioned to say that pain's all in your head. It's not. Your brain is a player here, but that's not
The
how all pain.
audacity.
It's not how all pain is experienced.
My brain is not that online, you feel me? For it to be all in my head. It's coming from somewhere.
Your brain does ask you, "Am I safe? Is this dangerous? Do I need to protect this area?" Stress, trauma, poor sleep, anxiety, depression, and like previous painful experiences can all influence those answers. That's why two people can have the exact same injury and experience completely different things.
And different levels of pains, different places where they hurt, depending on past injuries or even the chronic pain that they have. But it is always real to the person experiencing it, even if it's not real for them around those around them. It's always influenced by your nervous system, your emotions, and your brain's perception of what's going on around you.
It's like I've had an injury forever and someone else has recovered from it just fine. I did not.
This is, I feel like I hit my knee when I was a kid, and that knee still doesn't feel right when it's raining outside. Everybody has one of those things. If you're a chronic pain or autoimmune human being, you know what we're talking about deep down. But there's a caveat to that. Trauma and chronic pain like to road trip together. They're besties. Research shows that PTSD and chronic pain frequently occur together. National Center for PTSD reports that anywhere between 20 to 80% of people with PTSD also experience chronic. That's a huge jump.
Yeah, I know. I was like, the fact that they couldn't narrow that down, I was like, is it 20 or 80 or is it in between? They were like, no, but it's
Probably
20
because
to
they were
80.
they probably because they can't narrow it down because they told them it was all in their head. And so the people reporting it were like, yeah, no, I'm fine. It's not that. But trauma literally changes your body's response system to stress and what's going on around you. Your muscles
Muscles
stay
stay
tense, you
tight.
can't sleep.
And yep, and then inflammation increases. And the nervous system just remains on high alert. And when your body spends years preparing for danger, it's not surprising that pain becomes louder too.
It gets louder because it wants you to listen to it, but we
We're
don't.
really good at ignoring that
Really good at
because
ignoring it.
why would we listen to that?
Circling back to the badge of honor thing, I have to push through. And sometimes you don't have a choice but to. That's very different than what we're talking about here. But I've been saying chronic pain and autoimmune girlies and people, human beings. So let's jump into autoimmune diseases because I feel like there's a lot of,
It
I'm
gets
going to say
overlooked.
misconceptions. Yeah, it's definitely overlooked or people don't get specific enough, right? I have
Mm.
fibro. Yeah.
And a lot of we're seeing it now, the big jump in military members, veterans, first responders are being diagnosed with autoimmune disorders during or after their careers, especially they're getting med boarded, like with RA and lupus and multiple sclerosis and psoriasis and Hashimoto's and fibro or IBS. I feel y'all. These conditions occur when the immune system just it mistakenly attacks healthy tissues. And many autoimmune diseases cause chronic pain, profound fatigue, brain fog, joint stiffness, muscle aches, and inflammation. You feel like a dumpster fire. Absolutely.
Literally all the time.
I have an autoimmune disorder. Brittany has one. We go through chronic periods of flares and just absolutely, I can't today. I can't function. I don't know what I'm going to do. I am a garbage pail kid.
It's not even always about the pain that like I feel in my body. It's that coupled with the fatigue and the brain fog. That's I don't have the spoons for this today. Trust me, you don't want me doing therapy with you when I'm feeling like that. Because like I might be there in the room with you or on the screen, but I'm not really here with you. You know what I mean? Like I'm way more focused on other things, which is why that's important for people to notice that and give themselves space when they need it.
The frustrating part is these are invisible.
Totally.
And someone may look perfectly healthy while struggling just to get through the day. And it comes with a lot of judgment and stuff like that because people are like, you don't look sick.
But I am.
Yeah.
And while stress doesn't cause you, I would say that very loosely because depending on the type of trauma human being you are, those it might look I'm having a brain fart now. The increased levels of cortisol in your body over a period of long time, stuck in survival mode, can, but not always, right? Maybe you are just an autoimmune girly like Peggy or Christina. I don't know if fibromyalgia is considered autoimmune these days, but I think I've been misdiagnosed. That's another whole issue. Living with an unpredictable illness also increases the risk of anxiety and depression because people don't know how they're going to feel from one day to the next. I might be great today, tomorrow, I might be hurting.
And here's a fun fact for most people with autoimmune issues, it can take up to 10 years to get a diagnosis. That's on average, it takes 10 years. You will go through several misdiagnoses, but it could be this and it could be that. A lot of times an ANA won't show up positive the first time or the second time unless you're like actively going through the flare when you're taking the blood test. But most of the time you feel like such crap that you don't want to go to the doctor's appointment during that day.
And it's hard to convince people of that too, right? When Landon was born, they told me I had rheumatoid arthritis, which didn't necessarily surprise me, except for the fact that I was 20 years old. My grandmother had rheumatoid arthritis, so I was like, okay, that lines up. Then they were like, no, you have psoriatic arthritis. I was like, I don't have the patches. Okay. I'm dying on the hill that I have lupus. Have I been diagnosed with lupus? No. Have I been tested for it? Many times. Every time the ANA comes back, it's inconclusive, which doesn't mean negative.
My dad has psoriatic arthritis, but he's the only one to actually make it past this age of living in his family.
Yay!
I was like, I got it from you.
You ask anybody that has an autoimmune disease, they'll tell you that it was a literal fight, tooth and nail, to get a doctor to acknowledge what they were feeling.
Yeah. Again, it's your period. It's anxiety. It's depression.
Nothing sends a woman into homicidal ideation more than, are you sure it's not your period? At this point in time, we've all been having periods for 20 plus years. I think I would know the difference between what I'm feeling and period stuff. 100%. Sorry, guys that are listening, that we're making this uncomfortable talking about lady stuff, but it's the truth.
Yeah. But then after it stuck around after the hysterectomy, they're like, maybe it's not.
Maybe. I don't know. Also, we are not physicians. We are not diagnosing people with things. Please go talk to somebody, a professional, a medical professional. We know our own experiences, but everybody's experience is very different, and we don't diagnose that crap. So
Living with an unpredictable illness like autoimmune can increase anxiety and depression because people often don't know how they'll feel from one day to the next. It's so unpredictable. One day I'm feeling hot and on top of the world and I can do everything, and here's the problem, I'm gonna do everything.
And then we screw ourselves over because the next day we're like, oh, I did too much.
And I get in trouble for it so much because Josh will look at me very judgmental.
You
you
doing too much?
you did too much yesterday, didn't you? And I'm like, shut up. I didn't ask for your opinion.
Tib will see me in the action, right? While I'm doing the thing. And he's, I feel like you might regret this tomorrow. And I'm like, mind your business. I need this to feel regulated.
It's such a balance of should I do this today? If I don't, I'm just gonna have to do it tomorrow too.
Yeah, I think I feel like I have gotten better about that because I would personally, I would just push myself over the brink, over the edge 24/7. And then when I would ever take a day off, I would get very sick. And then I'd be sick for the whole weekend and have to take more days off the following week, which of course is like the deer getting shot and still running. And then as soon as it stops, it dies. We've used that analogy a lot in this podcast. And
So
this time it's
bad.
actually really
Accurate.
relevant.
Oh yeah. Oh yeah. Because we go into cycles. Because pain affects sleep. And it unfortunately can look like mania because we'll go without sleep or we'll sleep too much. When we stop sleeping, we're like, I feel great, and then we're gonna crash. We're gonna crash hard because we haven't slept in 48 hours.
That was like that day I was like, I haven't been to sleep. I actually feel like I'm in a better mood when I don't sleep. And Peggy's, that's concerning. That's a problem. I'm less grumpy.
So now it's coming.
I've been up and I'm tense all night because I can't sleep because I'm in pain. And so at some point you just give up. You're like, there's no point going to sleep now when I have to be up in an hour and a half. But then the rest of the day you're very tense, you're hurting. Or you might be riding the high of a Red Bull or coffee, but eventually you come down from that. You had that dopamine crash and you're like, I'm dead, literally.
Or I don't know about you, but like I sleep in this ballerina pose when I'm in pain. Like I have one knee bent and the other one like straight.
I lay like that by default. No matter where I sit, my left leg always comes up, my right leg straight, or it's one or the other, right? Which then makes my legs hurt even worse than they already do, especially my left one. That one probably is injured while we're being clear. I think I really did injure that one, but it hurts really bad.
Pain does weird things to your body while you're sleeping, while you're trying to sleep, or you oversleep. Because, like, I've done those where I'll go into, did I really sleep 16 hours? What happened?
Then you wake up groggy, kind of have like this low key headache, and you're like, I want to go back to sleep, but that's how I got here to begin with. So
Yeah, because you're like, am I hungover? Did I drink without knowing I drank? What happened? You're disoriented to all things, lost time.
I, I think the hardest part to accept as someone who has chronic pain like that is that not doing anything actually makes it worse, right? So there's a point where you've done too much and you've pushed yourself over the edge, but your body's in motion, stay in motion. And if you're not, you're like, oh, I'm hurting so bad, I physically can't do anything. The next day, you'll feel worse because you weren't up moving around, which is such a like catch 22. I have to move around so I don't hurt when I'm already hurting. Make it make sense.
Yeah, because like it contribute like sitting and stuff like that actually can make your muscles overly tight. Fun fact too, I didn't know that. And overly tight makes them again, makes your back hurt, makes your muscles hurt, makes everything hurt, makes your butt hurt.
Yes. Or your lower back. If you go from one chair to the next like I do, it's, oh, this kind of hurts. Okay. I need to get up and walk around, which I actually don't have time to do that often. So, yeah, if you're a sedentary, I hate that word when it refers to me as a therapist, but some people do sit more at their job than others, which actually you're like, wow, that's nice. You get to sit all day. Actually, it's not. It hurts.
A lot.
I need to get up and do like the stair stepper while I'm having a patient on my couch, right? Sorry, I got to keep moving.
Because these things contribute because we get in cycles of like depression and anxiety and those create muscle tension. It decreases motivation. You don't want to do
Gone.
nothing.
Non-existent.
And before long, people aren't just managing pain. We're just managing the cycles
Yep.
and we're just feeding it. And it feels like this monster we can't ever get rid of.
Like we're in survival mode. How ironic.
Surprise!
Surprise, we made it.
This wasn't in the next part. wasn't something I was prepared for, was pain changes your identity.
Absolutely.
One of the biggest things people describe isn't the injury itself, was losing versions of yourself that they used to be. And this happens, I see, with a lot of even our clientele. The
Yeah.
firefighter who can't climb ladders, the
Yep.
veteran who can't run with their kids, the police officer who had to medically retire, the paramedic who developed a back injury after decades on an ambulance. When your identity has always been built around helping others or being physically capable, chronic pain can feel like losing a piece of who you are.
The
And
grief
like,
is real.
because I remember Riley was still a baby when I started feeling it. And it's like I couldn't keep up with him
Yeah.
anymore. I couldn't keep up with Lucas, and Lucas was bat out of hell. I just couldn't.
Yeah.
Or I couldn't support my husband the way I wanted to because like I felt like I was always just in bed.
Literally. Or laying on the couch or somewhere. And I think that, along with where we talked about it being invisible, right? That's the emotional weight we carry. We feel guilty about it. I feel guilty about having to lay down for 2 days straight to feel better, only to feel a little bit worse, right? But people can't see that I'm in pain, so they think she's just being lazy. I hate that word. I'm not being lazy. I can be lazy if I want to be, right?
Like, there's a time I want to Netflix and rot.
Right. But usually I'm Netflix and rotting in that
But
same period of time because that's all I can do. I look around and I'm like, oh, I have to do all these things, but I don't have the energy or the motivation and I'm hurting too bad to do it. And I know I'm just going to make myself worse if I push.
then like Josh wants to come up behind me and hug me and everything hurts and I don't want to like physically recoil from him, but I'm like, oh God, please don't touch me.
It's not
Please.
you, I swear. See, my lower back and my lower back down, my legs hurts the most. And so I'm like, oh, if Sawyer is on top of me or he'll plop on me or even anything touching, it's like just someone shocking me with electric, like a fucking taser. Ah,
Because every joint starts hurting and you're like, back away. I love you. Just know I'm loving you from a distance.
I do feel like the guilt that we feel, and I'm sorry that I need to rest, that I feel like we were taught generationally from our parents because they come from, depending on how old your parents are,
Yeah.
was that Gen X? I think my parents are like right on the line of being
Boomer X. Yeah.
boomers and X, right? They pushed through everything. And if you weren't at death's door, then you had to just push through and deal with it, right? That comes like church, school, work, everything. So now
What
we
was
have
it
to apologize for resting and then we feel guilty about it. You got to give yourself permission.
on TV the other day? It's like a kid had cut himself on the TV show and he was like, if it ain't spraying, keep playing.
Tispo scratch. And like, I tell my kids that too. They're like, oh, I have a boo boo, it hurts. I'm like, are you bleeding? No, then you're okay. That was actually not true because that time Kelly broke her arm, I felt awful. She slept on a broken arm because she's getting hurt. So I thought she was being dramatic. Turns
See,
out her
we're
arm was
just,
broken.
yeah, because like we're just as guilty about it because like we're pushing some of that narrative because we're bad about it ourselves. So because like we have to apologize for resting or taking care of ourselves. And so then
Yes.
we push the narrative back on our kids.
And I think if you're neurodivergent, and by that ADHD, autism, and ADHD or whatever, Peggy can speak to this because although I am ADHD, I do not have autism, but I see it. And the more I learn about it, the more some of this makes sense. Where people on the spectrum don't have that felt body sense the rest of us do. And so they push harder and harder until they're literally bottoming out. How many times have I seen my kid bang his head to the floor of the wall and I'm like, God, don't that hurt? You don't feel pain the way that I do, right? And so when you have chronic pain and you're on the spectrum, how difficult is that for you to take a step back and go, whoa, I actually maybe need to take a break?
No, we'll just crash and burn. And it's really ugly when we do.
She's, no, I'm sorry that you think there's a point where I'm like, I need rest. She really will crash and burn and be like, I'm done for today. I'm going back to bed. In the best, most dramatic, anticlimactic way. It's the same. Christina and I are fighting for our lives. We're like, are you feeling like, yes, we're setting each other off, and Peggy's just, I'm out. And you don't hear from her for 2 days.
I will look at them both and go, I am unwell. Goodbye.
So wait a minute. Which one of us three set this chain reaction off? What have y'all been doing? I feel like we're all connected.
I'm like, tis I this time.
I think the last time it was Christina. And I'm going to knock on wood before I say this, but I haven't had a full-blown, like, flare in a while.
Yeah, you shut your mouth.
I knocked on wood. You heard that? My back has been bothering me a lot. And so has my leg. But like I said, that I think is an injury I need to get checked out. Don't be like me. Just go to the doctor. But having a full flare where I'm just like down and out for several days hasn't happened in a while. And I feel like that's because I've been honoring stuff internally a lot better than I used to, which is something you have to learn how to do, especially if you're in a helping profession.
That's because you're questioning constantly. Are you doing enough?
Never.
And, no. And that's why that's why you keep pushing through. That's why you constantly second guess yourself. Like, I haven't done this. And like, sometimes that has to be you have to answer yourself. That's a Monday problem.
Literally.
That's a Monday problem.
Like, I took off Friday for 4th of July. If you're not from the United States, that is our Independence Day. Okay. We love that for us. 250 years. I took off today too. It was so hard for me to just do nothing. Am I behind? Do I have stuff to do? Always. Did I do any of it this weekend? I did not. I rotted and went and swam in the pool and got a little bit sunburned and then rotted some more. Sometimes you just have to say, it's not going anywhere. Your work's not going anywhere unless it is. I'm not trying to tell you not to do your work, but you know what I'm saying. Those dishes are not going anywhere. The laundry, I have a whole basket of laundry right here in front of me. Unfolded since Friday.
Come here. No.
She's choosing violence.
She is.
People have to live their lives, sis.
Absolutely. And the emotional burden just starts becoming exhausting. Come here, butthead. Yes. You were doing fine.
And I think that as therapists, we hear a lot about the chronic pain world. I can't think of a single patient I have on my caseload right now that doesn't experience with some form of chronic pain. We're not going to be like, oh, maybe that's just anxiety, or we know what it feels like. And even if we didn't, we know the impact that life choices, trauma, and your work has on your body physically. So we're not going to invalidate that for you.
Yeah, I think validation is a big important thing when it comes to pain, knowing that you've experienced it for years and years. And even though a doctor may not have validated, and we're going to still encourage you to keep seeking a doctor during this time period and say it's not all in your head, and it's okay to want to talk to someone about that. That it's okay.
Absolutely. Therapy, even if you don't have some crazy traumatic experience going on, like, it does help you address like the grief, the identity changes that Peggy spoke about earlier that comes with the chronic pain, maybe even other mental diagnoses that you have, PTSD or otherwise. Yeah. Working together with us and your medical provider is sometimes like the best strategy.
There needs to be hope.
Yes. Hope. Living with chronic pain doesn't mean you're like that you ever going to be able to eliminate it completely. Sometimes it just looks like I got to sleep through the night last night without any assistance, or enjoying time with my kids, like Saturday when I finally felt good enough to go get in the swimming pool, even though it was 120 degrees outside.
Returning to hobbies, things that you used to miss. I remember I couldn't get through books years ago because I didn't have the mental capacity for them. Heck, school was rough just because I was in the throes of going through the diagnosis process.
Yeah, like you said, 10 years to get a diagnosis.
Yeah. That was just rough.
Learning how to calm your nervous system. This is accepting help, but also asking for it. You
Both are
have to
rough,
ask for it sometimes to accept it.
both are, and
Being able to
accept.
find,
But like when somebody offers you help, though, you have to take it. When somebody sees that you're drowning, and they go, "What can I do for you?" Even if it's something as, "Can you just get me dinner tonight?"
or I don't have the spoons to make dinner, and figuring out a compromise in between, doing the bare minimum. Sometimes I might not have the spoons to deep clean my entire living room, but I can sweep the floor and load the dishwasher real quick, and then I feel better about that situation. Easier to live with.
Finding purpose is a big one because plans are allowed to change. You're allowed to change course and directions of what you thought your life is going to be. Maybe you had thought, hey, this is the career I wanted, and that has to change, whether you're getting medically retired, whether you just need to pick something different that's less strenuous on your body. That's okay.
And you're
And
burnt out. You need a change.
yeah, pain's going to remain part of the story. It doesn't change the story. It's going to add to it, sometimes in a bad and shitty way. And then sometimes just in a different way that you're learning to accept again.
And giving yourself the space to be like, yeah, am I getting older? Yes, we all are, right? But it's not just a byproduct of that. Yes, things shift, they're a little bit more achy and funky when you're getting older, but chronic pain is totally different than I'm just getting older. You're not lazy, you're not weak, and you are most certainly not alone.
You remember that phoenix that comes out of the dumpster? That's what chronic pain is. It's the phoenix coming out of the dumpster fire.
Yes, literally, it's on fire all the time. Having chronic pain changes your life for sure, right? I can speak from that. I'm sure Peggy can too. Anybody else who's listening that feels validated in this moment knows, like this totally changed my life, but it doesn't define who you are as a person or your worth in your job or as a parent or a husband or wife or whatever you are. You deserve what it looks like to not, like, beyond the lab work, beyond the diagnosis of having lupus or fibro or rheumatoid arthritis or whatever.
Yeah.
You still deserve to be seen.
You deserve care that looks beyond the injury. Because lab work is going to suck a lot of times.
I
And
am
beyond,
proof of that.
yep, and beyond the diagnosis, we need to see the whole person.
Absolutely. Because if pain's not clocking out, then neither should our hope. That feels weird to say. Hope is gross sometimes too, but we're here for it. I always hope that I'll feel better another day, or maybe I will, maybe I won't. You just got to ride the wave.
I want to thank y'all for joining us. Please share and follow.
I need to make me a sign for that part. Yes, share and follow. Don't let me catch you watching the podcast. I've got 27 views and 2 likes. If you didn't like it, give us a thumbs down then so we know, all right, that you're just not being lazy and not hitting the thumbs up button. Stay tuned for more from Dr. Rock, myself, when I'm able to get that back online. We're getting there. Things are calming down a little bit, so we should be able to get back on track with that too. So stay tuned, and we will see you on the next one. That's all we have time for today, everyone. We want to thank you for tuning in to this episode of Holding the Line with GY6, where we are just a bunch of therapists who talk about the shit nobody else wants to talk about. We hope you got something useful out of it, or at least made you feel seen. New episodes drop every other week on our YouTube channel, Holding the Line GY6. Be sure to follow us on Facebook and Instagram, where we post more helpful info, dark humor, and more of the shit nobody else wants to talk about. In the words of someone wiser than us, go forth and do magical shit, everyone.